Hey everyone, it's my great honor to be with you today in this remarkable day with this elite group to shed some light on the role of MENASO initiative to increase mechanical thrombectomy access in the region. Stroke, as you are all aware, is a major burden, and the MENASO region is not exception. As a matter of fact, it faces disproportionate impacts due to aging population, prevalent vascular risk factors, and limited access. And it's expected that the stroke incidence projected to rise by as high as 60% by 2030. MENASO was founded by a group of 5 physicians in 2013 with the aim to improve stroke management in the region. We held our first annual meeting at that time, and our goal was to promote evidence-based stroke care in a diverse epidemiological landscape. Since then, we continue to grow and have more than 1,600 members and a strong network of political and professional ally, and we'll hope to continue to expand our impact. Currently, we are operating across 22 countries to address the complexities of a diverse healthcare systems with varying levels of infrastructure and resources. Our focus is to standardize and elevate the stroke care, promoting equitable access to acute stroke intervention, including mechanical thrombectomy, and reduce disparities between different parts of the region. Our vision is to have a unified MENA region where every stroke will receive timely access to evidence-based care regardless of their location. Our strategic goal focused on awareness and education, both public and healthcare professionals, training and capacity buildings to promote training of stroke care providers in alignment with standard of care and evidence-based guidelines, looking into our own data. If you cannot measure it, you cannot improve it, and promote research and encourage and support research focusing on regionally relevant priority, collaboration with organizations nationally and regionally and internationally to support education, training, and research, policy and advocacy. And this is a very crucial goal for us to influence regional key stakeholders and policymakers to promote stroke care and advance stroke preventions and acute treatments to improve outcomes and build a communication networks as what we're doing today to promote collaboration and align our goals with organization and important bodies. This is some highlights of key activities, key educational activities. We have an annual Congress or annual meeting. This year we'll have our 10th Stroke Congress will be held in Egypt, Cairo, in mid of September, so you're all invited. We're holding our monthly webinars and grand rounds. This year, we celebrated our 50th webinar in collaboration with ISFN in February, and those are available online, and it's a very useful resource for education for free. We hold 2 annual master classes, which is TOT, to train healthcare providers about stroke education. Those are some metrics about annual meetings. Our 7th annual meetings were held in Bahrain with close to 7,000 attendees. Our 8th one was in Abu Dhabi. And last year was in Riyadh with close to 6,000 attendees and more than 75 speakers from the region and abroad. Last year, we held 2 master classes, one in Egypt and one in Jordan. And this year, we're planning to have 2. One this month is going to be in Tunisia, and next it's going to be in October in Algeria. This year also, we hold the 2nd annual MENA Venom event in collaboration with ISFN Mission Thrombectomy, which was very, very successful event with over 500 attendees. This is a hands-on neurointerventional condensed 3 days meeting with live case transmissions, hands-on workshops, some in-depth lectures and debates. Those are some highlights of the conference. And in the top left-hand side, you see in the pictures Professor Ahmed Al-Basyouni, who's championing this event, talking about 2 landmarks or milestones in 2016, where the Ministry of Health during the annual meetings covered thrombolysis, in 2018 where they approved universal coverage for mechanical thrombectomy. You can see our distinguished guests, Dr. Fawaz Al-Mufti, Dr. Maino, Dr. Hisham Masoud, and Dr. Hamza Al-Bayati, among other distinguished experts, the presidents of WSO and the presidents of ESOs, among key stroke experts from the region and beyond in this successful meeting. Another area we work on is certification accreditations with respected organizations like American Heart Association, American Stroke Association, WSO, ESO, and ISVEN, and we have currently 3 joints program which helps to standardize certification of stroke centers and also mechanical thrombectomy capable centers. This helps to enhance our public awareness, improved our educational activities, and strengthening stroke education, expansions, of course, of stroke centers, not only in numbers, but also in quality. This together helps to drive a meaningful change and impact in the region. This paper kind of go over the journey of MENASO and some of the important milestones and achievements. It was published in 2020 and highlighted the first 7 years since the establishment of MENASO, where the numbers of stroke centers, stroke units, increased utilization of acute stroke interventions such as thrombolysis and mechanical thrombectomies by significant means. When we look into the expanding the access to mechanical thrombectomy, our sections of neurointerventions working on mapping, supporting, and expanding mechanical thrombectomy centers. They do visits and auditing and provide continuous support. We are working as a group during our meetings to increase advocacies with ministries to fund and equip. I highlighted the example in Egypt and also in Bahrain in 2022. Where we worked in the putting plans and in continuous dialogue with stakeholders and representative of Ministry of Health, highlighting the cost effectiveness and importance of timely mechanical thrombectomies and providing universal coverage. This leads to a rise in mechanical thrombectomy centers across the region and major cities. Which was highlighted by this landmark paper that was led by Asif and the group of Mission Thrombectomy, and we proudly were part of this. And as you can see, some centers in the region like Qatar and Bahrain were listed on the top 3, and to less extent Saudi and UAE with thrombectomies percentage around 10 to 12%, and to lesser extent Jordan, but still there is a lot of work needs to be done to improve access for this intervention. I want to share with you some success stories from the region. Unfortunately, for the sake of time, I cannot highlight the importance work that was done in the ground, but you can see that for example, mechanical thrombectomy number grew by over 400% between 2016 to 2024. The number of stroke units were 5 when we started working back in 2014 with Dr. Hani Arif and Dr. Sam Salah and Ahmed Abdul Alim. Now they have over 100 stroke units. Tunisia last year, they had the first MT centers with full national funding. I want to highlight in Saudi Arabia, we have a nationwide stroke virtual network, and that I will highlight. And we had our first mobile stroke unit, which is the first in the region. UAE, they are using technology and AI integrations to improve workflow across Abu Dhabi and Dubai. Some examples from Saudi Arabia, which I'm very familiar with the system, but there is also an excellent work from different parts of the region. For example, the pre-hospital notifications now is into 25% of the hospital, over 100 hospitals, where the CT scan would be the drop zone based on the fast ED triage system with the red crescent. This is our Saha virtual hospital, which is one of its kind because it's in Riyadh, which is completely virtual. It's the largest in the world, and they are connected with over 50 rural and peripheral hospitals providing acute stroke diagnosis and interventions and triaging. They've seen more than 8,000 consultations since they started in last 3 years, with thrombolysis rates approaching 28%, and their thrombectomy is around 10%. There is a hotline where any center or any healthcare provider can call directly to to triage and move stroke patients by ambulance or air ambulance. Just to highlight the growth in mechanical thrombectomy, I'm using data from King Faisal Specialist Hospital where I'm working, where you can see number of thrombectomy significantly rise by more than 90x from 2017 to this year, where we projected we'll have over 260 cases of mechanical thrombectomies. Some highlights of public awareness campaigns. You see this iconic building of Burj Khalifa, where during the World Stroke Day, we'll highlight the fast and we educate public about signs of stroke. We do a media partnership for fast campaigns in Arabic, English, and French. We have social media outreach platforms, and we make sure that we are present in TV, news, newspapers. And this year, we're targeting rural communities and EMS engagements. The future projections or road ahead, we want to expand access to rural and underserved population, leveraging technology and telehealth to enhance triage and delivery. Of course, we are not only focusing on acute interventions, it's important to work in prevention efforts and to promote MENA-wide improvements, working in quality to ensure continuity and quality of care. And our vision by 2030 that our regions will significantly reduce the stroke burden, where timely, equitable, evidence-based care is the standard regardless of your locations. With that, I would like to thank everyone for giving me this opportunity. Thank you.